Minister, thank you very much for waking up with us. I hope you're done with your dumbbells. I'm told that is the exercise from 6 o'clock. But Minister, this virus has been with us for over 100 days now. I would like a reflection from you about the modeling. Are you still, which scenario are you using? Perhaps I should phrase the question. Are you still using the worst case scenario or best case scenario? And what does it mean, whichever one you choose to go with?
We are using the scenarios equally. We basically look at what is proposed to be the most optimistic and what is the pessimistic scenarios. Whilst we are not married to the numbers, we want to use the fact that we want to avoid things getting as bad as the forecast is suggesting. We also want to make sure that we try and keep the numbers as low as can possibly be done. So we are looking at all the various forecasts to look at what is it that we need to do in preparation so that whatever happens, we are ready to deal with whatever eventuality. Yeah. So as we speak now, we are seeing that the numbers are increasing. We don't believe that the numbers have to what we as South Africans do. So we can have the forecast, but we can actually behave in such a way that the numbers that are in the forecast don't materialize. Yeah. But we can also do things in such a way that even the most pessimistic scenario can actually be overshot, whereby we do worse than what the pessimistic scenario is. It all depends on how we ourselves change our behavior.
Yeah, Minister, the projections, the overall projections, they've put the death toll at around 40,000. Is that still the scenario you're looking at?
I will not take any of the numbers and publish them. We will just note that there are those scenarios. All we're asking is that we as South Africans must understand that we have had to change to a situation where we open up economic activities, social activities. We've tried to teach the public to focus on distancing and ensuring that we use masks, because that's really what will determine what the numbers are. It's not the focus, but it's more the behavior that is important.
I'll tell you the reason why I'm asking these questions around the overall death toll, Minister. This 40,000 that we have heard before, the reason I'm asking you about this is it comes on the back of the introduction of the Dexamethasone that is now introduced into the system. Would those people still possibly die even with this particular medicine that has been made available that we are told is and very capable of preventing deaths?
Thank you very much for clarifying that, because you are asking a very pertinent question. Now, when this dexamethasone was announced, it actually indicated that it has been found useful on people who are on ICU, who are critically ill, who either are on oxygen or on ventilators. It has therefore improved the lives of those who are on ventilators by 20% and those who are on oxygen by about 30%. Now, that means it reduces the numbers of people who die. Doesn't necessarily stop anyone from succumbing to the infection, to the COVID-19. That's the first aspect. The second aspect is that it has no effect on people who have got other symptoms, milder symptoms. However, our biggest concern is that it is very much associated with what we call comorbidities. In other words, when we discuss death associated with COVID-19, we describe about 3 or so scenarios. One is a scenario of someone who was well and then suddenly gets attacked by the infection, then get respiratory distress or gets a coagulopathy and suddenly succumb directly from the impact of the infection, which is a direct cause of death. Then we've got another situation where we've got people who have got other conditions, maybe cancer, advanced stage cancer, maybe advanced age, maybe advanced diabetes or uncontrolled blood pressures and so on. They might die of those situations, but the fact that there was COVID-19 worsens their condition that was pre-existing before. You still end up with a mortality, but it is linked more to the comorbidity, but it's been precipitated by the COVID-19 infection. Then, of course, you've got others where we will find that they would have died for something else, but then they still are testing positive, and we call that associated. So all of these we have to count in because of statistical purposes.
Yeah.
So the dexamethasone, when we bring it in, it's got a limited but very helpful impact on those who end up in the hospital with a very critical kind of illness. In the estimation that has been done, 42% of people so far who have gone into, who have been under ventilators have actually succumbed. If you have dexamethasone, we hope that that number needs to be reduced. But we need to make it clear that it doesn't mean that now there's dexamethasone, no one will die of COVID-19. It must not be misunderstood to mean that. It must also not be misunderstood to mean that people who get the infection, if the numbers are allowed to be too huge, you will end up with people who may not even be able to reach the hospital because of the large numbers that are overwhelming our health services. So the balance in understanding the role of the very helpful drug needs to be understood in context.
Minister, very interesting indeed. I want to link then two questions to this medicine, dexamethasone, and that is that what is the peak, or when do you expect the peak in the epicenter of the virus, which is the Western Cape? We're hearing reports that it may be this week. And linked to that, do we have adequate supplies then of this dexamethasone to ensure that those who are on ventilators right now have a possible chance of surviving?
Well, we expect that the numbers will continue to rise and will peak any time between this last week of June towards July. We expect the numbers can be anything, and they can go much higher. So we expect that those numbers are going to keep increasing. Then the issue of dexamethasone, at the moment, we have just got about over 4,000 people who are hospitalized throughout the whole country. And of those people, you probably have got about 800 who are about 500 on oxygen and about 200 and some, there's 250 on ventilators. Now that number that's where dexamethasone will be actually helpful. And so the stocks we have at the moment are enough because let's just remember that dexamethasone has always been used for many decades in the country and all over the world for other conditions such as problems of brain edema, asthma, very severe asthma, and other autoimmune situations. So it is something that is available. We have also, since it has been now put into the protocols of treatment so that everybody must then be able to use it, it basically means that every hospital can actually use it because almost every hospital will have dexamethasone or at least can get it. So we will therefore be increasing the stocks. At the moment, we've got over 340,000 vials, which means that for the next so many weeks, we'll be able to have some enough of it, but then we'll keep increasing the stocks and we're going to be ordering more and more of it.
Last question on the Western Cape, Minister. I want to move on to other provinces. In that province of the Western Cape, you have written in a Sunday paper this past weekend that your major concern are people who are infected with this virus refusing to comply with either quarantine or isolation facilities. What is the possible solution here, and why are people doing this?
Well, the situation in the Western Cape has been a bit complicated. We did indicate earlier that our major weakness there was at the start was the gap between traced, the identified contacts and those that were ultimately traced, and then also those were put into isolation and quarantine. That was pretty weak, and we've worked on it, and now we've come to a point where the contact tracing is good. We've put in an ICT platform that made it quite, stronger. So we have got strong teams that are working on it. Now we've actually opened up additional rooms, beds for people to be taken for isolation and quarantine. But we are finding that communities are actually reluctant to go into quarantine and also into isolation in some of the instances. So what we have now done, we have actually we're mobilizing social partners, non-governmental organizations. We've actually called the churches to come in on board. We're sending also our Ministerial Advisory Committee on Social Behavioral Change to look at it. We're also inviting social scientists, psychologists, and behavioral scientists to work with the community so that you can get the right messaging and understand the attitude that make people feel that they are not able to go into quarantine. Yeah. It's a real setback, and I'm very concerned about it. Excuse me. And we will continue to work together. At least we are aligned at the level of the government, provincial, national, and city and municipality in terms of what needs to be done. But what we now need is to be able to, impress upon our people about the need for us to allow people to go out onto quarantine, because we have to break the cycle of infection. And if we don't do so, we can never expect these numbers to be reduced. Yeah. So there's a lot more effort that's been put into it.
Then let's come to Gauteng, Minister, which is where I am, and it's reclaimed the number 2 spot from the Eastern Cape province. Do you have any major fears here, very briefly?
Well, originally, we did anticipate got the highest population too. It's got a lot of informal settlement with densification where quarantine and isolation are very difficult, and a very high movement of people from all over the different provinces. So we did anticipate that we will have a challenge. And of course, with the reopening up of the economy and people coming back into the mines, that's pushed up the numbers. We remain concerned. We have actually asked, we had a meeting with the Premier and the Minister, the MEC for Health and other MECs, and we agreed that we need to really intensify on the area of quarantine and isolation. They've done well up to now. They just need to keep to it so that we can reduce the problem. Yeah. Where I see the weaknesses is that, for example, some of the mines, the people are coming from various other provinces, but they come in and settle in the informal settlements. So when they are positive, it's very difficult to isolate. And so we now need to work very closely with some of those mines. Now, the shops, the retail outlets are also an issue, and some of the factories are an issue. So there are going to be areas where they've got to stop operations, close them and reopen, and so on. So we are going to have to fight very strongly to be able to reduce the numbers, or to reduce the rate at which the infection is spreading. The numbers are going to be going up, and we really need to understand that it's no longer what a department or what health workers alone can do. It's really up to the whole society to take up the challenge.
I'm glad, Minister, that you're raising the issue of the economy, Gauteng being, of course, the major economic hub in the country. But I want to take you to a different province, which is KZN, talking about the economy. The Premier there yesterday briefing saying that his province has suffered a 30 billion rand contraction to the economy there. Now, as we reignite the economy, Minister, I want to ask you a very simple question. Do you foresee an event taking us back to a hard lockdown?
I can never rule that out. I can never rule that out, because what we are monitoring is the rate at which the infections are going, is the rate at which the beds, the staff, the equipment and everything in every area, can it cope? If it begins to be threatened that we may not be able to cope, we might well be forced to consider a lockdown, maybe not exactly in the same way as would have happened in the whole country. It might be localized in a district or a sub-district, but I can never rule out a possibility of a lockdown which might be tailored or localized. I think that as we sit here as all South Africans, we need to understand here that, it's not a question of what we want to do. It's a question of what are we forced to do. And in this case, even when we get questions from the media, it must always be clear. We mustn't, when we have a challenge and we have to take a decision, that's a hard decision, be portrayed as though it's a sense of the responsibility, or we're now neglecting one area, one aspect, and not caring for the other. It's a very difficult choice that we have to make. How do you make sure that you can open an economy when, in fact, there's a high transmission, because the areas which we have identified as hotspots are the areas where there's high transmission. That's where the highest economic activities are happening. That's where the highest mixing of people is going to happen. That's where the highest numbers of informal settlements are. That's where the highest number of poor people are. In fact, there are more poor people in big metropoles than there are in smaller towns. And these issues are serious combination of factors that you have to keep balancing. So it needs a careful balance. It needs a united approach. It needs all of us to understand we send one message at a time and not create an impression that we're now wrong when neglecting the economy, now we're wrong when neglecting the lives of people. Yeah. It is not correct. What we need to do is to make it clear that we're trying to make a choice that's going to keep people alive at the same time, give their livelihoods also sustained.
Final question, Minister, and it's going to be with respect to the Eastern Cape province. The infection rates among healthcare workers is coming up as a major concern, particularly in that province. And I speak to you this morning having read a report coming out of that province that 56 workers in the Komani Frontier Hospital have tested positive, and making matters worse for them, they are handling patients who are psychiatric patients, and those people are going, by their very nature of the illness, they're going to be very difficult to try and deal with. How's this affecting your response on the ground, Minister?
I think we must always send a very strong message of support and sympathy with our health workers. They are in a very difficult conditions. They live in communities that may well be infected, and that where they can get the infection themselves, they have to go and work in a setting where the patients might also be infected, and they've got to survive through this whole situation. Now, we have to every now and again try and test them when we think that someone is infected, manage the situation by getting them out into isolation. In some instances, we've got to provide areas for them to work and live away from their families, where there's a fear that they might not be able to isolate properly or to manage the situation properly. All of these are day-to-day challenges that we have to face. Now, in the whole country, we have actually over 2,000 health workers who have been tested positive. And the last I checked, which was about a week ago, about 80% of them were actually in the Western Cape. The numbers will more or less increase depending on the level of infection in both the community, in that particular community, in that particular province. And therefore, we are not surprised, but we also have to work very closely with our members. We still have to protect them. We've ordered a huge amount of protective clothing for them. We've also ensured that every day we check the stock so that they are able to be protected as we move along. So it is a difficult situation. We have to work very closely together. The area of psychiatric patients is also a specialized area. They normally know how to handle them, but also we need to increase protection at that level. And it means also we have to make sure that in those particular areas, we've got additional backup staff in the event that someone has to be withdrawn because they are positive.
Minister, as I end this with you, just a quick question. Have you made that all-important call to Usus May in KZN to find out if she's good?
No, she is fine. Thank you very much for asking. She is fine. I am in KZN, so I've just made sure that she is fine. So thank you very much for asking.
Thank you. Thank you very much, Minister Zweli Mkhize, our Health Minister.